So hello from Boston. My name is Sandro. Most of you probably know me as Sandro. I'm postdoctoral fellow in Global Health and NCDs here at the Harvard Medical School and Harvard School of Public Health. I'm an Australian medical graduate. I was lucky enough to go to Monash, graduate in 2008, and then work with some of the likes of Rob Mitchell and Jenny Jamison in 2009 as an intern. I did a Master's in Public Health and have recently completed a PhD in Global Health and Epidemiology based at the Copenhagen School of Global Health in Denmark. So first of all, I'd like to congratulate the team at the Global Ideas Forum. What you guys do is a phenomenal and inspirational effort, bringing together inspired young medical graduates, healthcare graduates and others to discuss, explore and be inspired to address the leading global issues in health and healthcare. So to Lloyd, Jenny, Rob, Rangi, and obviously also under the vision of Rob Moody, a sincere well done and congratulations, and it is truly inspiring. Rangi and the team have asked me to briefly talk to you today about advocacy. One of the things that I've been working on with a group of young professionals around the world in the last 12 months is a global social movement called NCD Free. NCD Free started out of a conversation with a few colleagues last year. We were talking about the issue of NCDs, the non-communicable diseases, or diabetes, heart disease, cancer, lung diseases and mental health. These diseases are the leading cause of death. They kill more people than any other cause, including HIV, TB, malaria and maternal child health causes all combined. But in particular, NCDs continue to be seen, whether it's at the political level, and I see this every day in my job, or whether it's at the local level, at the societal level, they continue to be seen as diseases of fat, white, lazy American men, when in actual fact the true face of the epidemic is likely to be young, under 70, it's likely to be female, Asian, and living in poverty, in stark contrast to what people think. And we felt that this misunderstanding was a fundamental barrier to meaningful political and social action. So what we did late last year, we decided to use social and personal narratives to rewrite the issue on NCDs. So we launched at the same time. I was in Melbourne, and my brother actually is a fantastic communications and design expert. He runs a communications consultancy company in Melbourne called Local Peoples, based in Northcote. And we were having breakfast, and I was explaining this issue, that there's this misunderstanding. People see NCDs as a disease of affluence, when in fact it's not, whether that's in Australia or whether that's globally. And he said to me, Sandro, this doesn't sound like a public health issue. This sounds like a branding issue. We need to rebrand NCDs. We need to get communications people involved, and we need to develop a social movement that aims to redress and to rewrite the narrative on NCDs. So he was absolutely right, and we decided to pair up. His communications design and design thinking background, my medical and public health knowledge, and out of that was born NCD Free. So earlier this year we launched a crowdfunding campaign through Indiegogo. We raised around $60,000 from people around the world, institutions. We raised $10,000 from the UN, and then in addition we've raised a further sum of money to support our launch efforts. But I'll explain that in a second. So with this money, what we wanted to do was two basic things to rewrite the narrative on NCDs. First of all, we wanted to use social media, and we wanted to use emerging media and technologies to connect with young people in the millennial generations. And they were really our target audience for re-communicating the NCD message. We want to do this, as I said, in two ways. First of all, we wanted to make three short films focusing on inspiring young change makers from around the world who are working at the community level in developing countries to change and to improve the issue of, or to address the issue of NCDs. I'd been working in Mongolia. I had some colleagues that I'd known, very inspiring colleagues, young guys in Northern Africa, and then also a group of young people throughout Europe. So we decided to make 3 short films, first focusing on, as I said, a young changemaker from Mongolia, a young changemaker from Ghana, and then the third film we actually crowdsourced. It was commissioned by the WHO. We crowdsourced footage using people's iPhones from across Europe, brought the footage together through a competition, made a short film, and then actually took it to the WHO United Nations meeting in Vienna last month, presented it to the 53 ministers of health from across the European region, and also brought 2 of our contributors who won a ticket to join me at that conference to present the film. So the first thing that we wanted to do is to create these 3 short films, short narratives that clearly communicate 3 essential messages. Firstly, the global burden of NCDs, the leading cause of death. Secondly, that the fundamental link between NCDs and poverty. And thirdly, that something can be done. 80% of diabetes and heart disease and a third of cancers are currently preventable with the tools, knowledge and skills we have today. And that there are young people in the world who are not only inspired, but actually able and willing to take on this cause and make a change. We wanted to profile them, their story, but also rewrite the narrative on NCDs at the same time. The second thing that we're doing with the money is we're holding 2 global launches. We've teamed up with a director from TEDMed, wonderful, inspiring director based out of Washington. We've teamed up with a number of world-class institutions, Oxford, Harvard, the University of Melbourne, ANU, the University of Sydney, the George Institute, also C3 based out of London, the University of Copenhagen, Live Strong, the list goes on. A wonderful group of universities, institutions, and even our old high school, Wesley College in Melbourne, came on board. So with their support and with the support of the public through the crowdfunding, we're holding 2 global launches, one on September 23rd here in Boston and one in Melbourne on October 5th as part of the Melbourne Festival of Ideas about 10 days later. The 2 launches will be TED-style events, so sort of think TED meets NCDs. They're going to be powerful, interesting, innovative and engaging events. They're going to be about 2 hours in length each, and both will see 6 inspiring young change makers, at least half from developing countries and most not linked to health or healthcare, take to the stage for about 8 minutes and give a call to action based around their personal story and their vision for NCDs. So some of the young people we have a young medical student coming from Ghana and another one from Kenya. We have a dietitian coming from Bangladesh. We have an urban designer, an inspiring young urban designer who has this vision for a healthier cities based in Melbourne. We have an economist. We have a health technology specialist. We have a policy specialist from the UK. So we have a fantastic group of 12 young, inspiring people, all with very diverse backgrounds, very diverse visions of how to address NCDs, quite removed from the healthcare or health system, and all evidence-based, but passion-inspired. And they're going to take to the stage for 8 minutes, 6 at each of the events, in front of an audience and filmed to create vodcasts as a lasting legacy. In addition, in between, we're going to launch our 3 films. We're going to have musicians, we're going to have comedians, we're going to have some informal sort of discussions and chats. It's going to be a wonderful event across the two venues, and we're super excited. So this is NCD free. In terms of the future, we really don't know where it's heading at the moment. There are so many opportunities, people coming out of the woodwork wanting to support further initiatives in lower middle income countries next year. We'd love to take crowdsourcing to a new level. We've crowdsourced the money, we've crowdsourced the video to make one of the films, we've crowdsourced a lot of the ideas. We'd love to take it to another new level of crowdsourcing next year in 2014. But basically, it's been a wonderful ride. It's been a wonderful journey, and we've been very excited and very lucky. But it hasn't come by accident, and I think that there are 5 sort of key messages that I wanted to share with you, reflections that we've made from this NCD free campaign. So the first one seems a little bit obvious, and I hope that this doesn't sound in any way sort of blowing my own trumpet. But I think the first thing is you need to have a good idea. You need to have an idea that is going to engage people, that is going to get people excited, and that when you talk about it, people will be thinking, wow, that makes sense. That's a great idea. I want to get on board with that. In addition, though, you don't want to reinvent the wheel. We very often fall into the mistake, I think, of setting up new NGOs, setting up new campaigns when people are already doing great work in that field already. And I believe firmly that if you're passionate about a certain cause and there's a wonderful group already doing something in that space, join them, support them, help them. Don't reinvent, duplicate, and distract. I think we saw an empty space in this area. We saw a big problem, a disconnect between the fantastic work the Lancet's been doing with the Lancet series on NCDs and the knowledge and understanding held by politicians, public, academics, all sorts of people. There was this disconnect, and we wanted to bridge that. So a good idea that thinks outside the box. I think they're the first 2 points. The third point is make sure that you have a multidisciplinary team. Doctors are great, don't get me wrong. I'm a doctor, and 93% of WHO is doctors, but at the same time, we're trained to think in a certain way. We're trained to look at a problem and find a solution. Whereas if you I'm sure you've realised this, but if you talk to your friends who are lawyers, or your friends who are teachers, or your friends who work in human resource management, or design thinkers like my brother, they think in a very different way. They analyse in a very different way, and they'll come up with very different ideas that complement the driven, sort of outcomes-driven, focused, and very kind of decisive nature of a doctor. So number 3, make sure you have a multidisciplinary team. Get people on board from different backgrounds with, and particularly get someone on board who is sort of a creative design thinker, can think outside of the realms that you and I, certainly I, could even imagine. So that's number 3. Number 4, look, I think it's a sad realization that I've had over the last few years, but being pragmatic, a lot of what one can do in life is about who you know and not what you know. And I think it's absolutely crucial to still, it needs to be evidence-based, and it needs to be credible, and you need to have obviously the academic and the credentials to be able to stand up and say that this is a health problem, and the medical degree will help you with that. But connections are so important. During this campaign, I really drew in a lot of the connections that I've been making over the last few years. So most of the organisations that I mentioned, WHO, I established my relationship with them probably 8 years ago when I did an internship in Geneva, made very close friends with a few directors, and have since kept in close contact, work with them on a daily basis out of Copenhagen. The George Institute, again, was through one of our team members. Live Strong have been following the work that we've been doing, and some of the organisations have been following us through Twitter, some of them have been following us through Facebook, some have been following my publications. But having the connections, having a group of people who are connected globally and are able to call someone up and say, look, John, this is a great idea. I know you'd support it regardless of whether we knew each other, but it's going to get on your desk because we know each other. Can you come on board? It's crucial. It made a huge difference to have global connections around the world, and also strong connections. People like Rob Moody are, phenomenal. He is a wonderful, wonderful man, but also incredibly connected and passionate about supporting young people and inspired young people in the field of global health. People like that can make an enormous difference to your idea and to catalysing your vision and what you want to achieve. And finally, so that's four sort of key messages. And finally, hopefully what you've seen in this video is that I'm not a boring Harvard academic, and despite my glasses and the obligatory old books in the background, I'm not sort of the fuddy-duddy academic. You know, I have vision and I have passion, and I think that they're the most important things if you're going to start something and start an advocacy effort or movement. People want to see that you're inspired by what you're talking about. People want to see you go off on a rant about something, you know, that it gets you really fired up. And, you know, if it gives you goosebumps, and if it makes the hair on the back of your neck stand up when you talk about it, and if you know, once you start talking, your friends and family simply can't shut you up, which is pretty much how I am with NCDs, social determinants of health and development processes. Then you're onto something, and you should jump on board, and others will follow. But having passion, being truly inspired by what you're trying to achieve, that's the number one, you know, the number one important element of any advocacy effort. So that's it. That's you know, my short advice on advocacy. I hope you guys have a wonderful time at the Global Ideas Forum. Again, well done to the team. Keep up the great work. I wish I could have been there for the forum, and I look forward to attending in future years. From Boston, have a wonderful time, and good luck to everyone.